G'day everyone, it's Simon Ashley here, and this is Health Highlights, a show about health, health professionals, and the people and the stories behind the names that we often hear about, but we seldom get to meet. And today it is a great honour to have Asher Morrison with us. Welcome, Asher.
Thanks.
Asher is a renowned clinical psychologist who specialises in children and adolescents, but he's also renowned as one of the best hair. He's got one of the best hairs in Newcastle. How long does it take you to get the hair like that, Asher?
Oh, look, it's probably taken a good 30 odd years.
Oh, look, it's
doing absolutely nothing to it.
It is very impressive. So, look, we had a lot of questions, Asher, about this interview, so we'll get straight into it. So, the first question is, what do you see as the biggest problems facing our kids today in this society?
So, there's a range of issues that I would sort of work with children in my role. Range of disorders, things such as anxiety is on the increase. Your behavioural disorders like ADHD, ODD, autism spectrum seems to be more prevalent now, or at least more diagnosed nowadays. But I think one of the main threads that tends to go through a lot of those diagnoses and issues is that of emotion regulation. It's something that I would probably work on with the majority of children that I see. For instance, if you have a child who is experiencing issues with anxiety, then obviously the main emotion that I'd be helping them learn how to regulate or settle down is fear. For those who have ADHD, it might be excitability. And I generally find that that's a core skill which tends to be a recurring theme in most of those presentations.
Okay.
Yeah.
So, talking about autism, that's certainly a big issue around in our community. There seems to be such an increased prevalence, if you like, of autism in our society today. Can you sort of shed some light on maybe some reasons why that is?
Yeah, I think part of it is that diagnosis is probably sharper and better now than it used to be. We know a lot more about autism than we probably once did. Generally, a lot of families I talk to where, might be giving a diagnosis of autism as we're sharing, and I'll ask about family history. They'll be like, Dad was similar when he was a boy, or, Uncle so-and-so was similar when he was a boy and still is, and so I think diagnosis has gotten a lot sharper and a lot better. And I think the other probably increase in prevalence is just an increase in awareness. So people know about it now, people talk about it now, so it's probably a more noticeable issue than it once was.
Okay.
Yeah.
And so I suppose that leads us to the next sort of question is, as a parent or say a caregiver, when we're working with kids, what are some of the signs and symptoms that we probably want to look for in our kids that maybe indicate that they possibly might be on the spectrum?
Yeah, so there's a couple of things. There's two core clusters of symptoms or problems that we would look for with children who might be on the spectrum. So the first is what we call social communication issues, which is your ability to engage with others and maintain appropriate relationships, so friendships and as we get older, romantic relationships and all those sorts of things. So we look in that sort of social domain. That's one cluster of symptoms. The other is called unusual behaviours, which is where you have a lot of your obsessive interests, need for structure, some of our sensory intolerances too. They fall in that second cluster. But even with those two clusters of symptoms, the social communication and the unusual behaviour, something that needs to be kept in mind when diagnosing autism is that it's a developmental condition, which means that we need to understand what is appropriate for other children of that age. So for instance, young children, infants, probably all engage in what we call parallel play, which is where you do your own thing alongside someone else without necessarily interacting. But as we get older, we would expect children to be engaging in more cooperative play, and it would be when you have a child who perhaps is still engaging in that parallel play that would be an issue. Not an issue in infancy, but as you get older, maybe.
Right. Wow.
Yeah.
Okay. And so, what are some of the key, maybe 2 or 3 strategies that we as parents and also teachers and that sort of thing can actually put into place now to actually deal with kids that have autistic tendencies?
Yeah. So. Probably one of the main things that we tend to do with children who are on the spectrum is to help coach them in building and sustaining meaningful relationships. The analogy I like to use with families is that of cooking. So I'm not much of a cook, If I go to the fridge or to the cupboard and have a look at it, I just see a whole bunch of items. I don't see a meal. I see some objects in the cupboard, some objects in the fridge. But if you give me a recipe, and if you say, grab these things, mix these things together, all of a sudden it makes sense to me. That's what it's like for a kid who's on the spectrum, is that they get into a social situation, they see a series of items, events, things going on, but mightn't necessarily be able to pull it together in how to interact or how to manage that situation. So a lot of the best strategies we have with helping children on the spectrum in that regard is to make some real concrete instructions or recipes around how to manage different social situations. And there's lots of fun ways we do this. We do it through social stories, we do it through games and role play and using other mechanisms like that. But the underlying theory behind it is to make those things explicit and concrete, because we might be having trouble picking up that stuff intuitively.
Probably one of the biggest concerns for parents particularly is, how do we develop resilience in our kids to actually cope with the world that we live in today?
Yeah, good question. I think there's lots of things that are probably affecting the resilience levels in children in general. Probably one of the main ways that we can help develop resilience in children is to, coming back to what I first mentioned, which is building our ability to regulate emotions. So making sure we're spending time giving kids the strategies and the tools to be able to deal with unpleasant emotions when they happen. A simple way to do this is to spend some time talking about the emotional element of things when it happens. So our tendency as parents is often to problem solve. So if your kid's had a hard day at school, you're sitting in the car, you're likely to say, what happened? Tell me what happened. Who did what to you? Give me their address so I can go and sort them out, or whatever we might be trying to do. But often the most helpful thing we can do is to just show a bit of empathy and help them to sort out the emotions of what's going on. Be like, yeah, you seem a bit frustrated today, buddy. You seem a bit down, Yeah, I can tell that would really hurt, or that reminds me of a situation I was in where I felt the same. That builds your child's emotional vocab, which goes a long way to building their ability to regulate their emotions. You can't effectively regulate an emotion if you don't know what it is you're feeling. So helping kids to understand that stuff, I think, helps a lot. That's probably one thing we can look at doing, I reckon, to help kids be a bit more resilient.
Yeah, well, that's great. That's really good. So the other thing that's really big at the moment is screen time. Now, I actually have heard there's some new research that's come out about screens that says that not all screen time is the same. What's your thoughts on that, Asher?
Yeah, look, I think that there's definitely types of screens which, or screen usage, which has different effects. So the classic one is that television, perhaps compared to computer games, television tends to not be as addictive, doesn't create as much irritability or frustration as perhaps a computer game would. But I think that, having said that, the overall quantity is still important. I think there's a number of reasons for that. The American Pediatric Association says that the guidelines are 2 hours total screen time. Television, computer use, phone use, everything should be 2 hours for the entire day. And I think that's a good guideline to follow. I think there's some important reasons behind that. One is that excessive computer usage can lead to addiction. It can also lead to increased irritability, particularly when you try to get them off it, or when you happen to walk through the room and creak the floorboards or breathe too heavily and disrupt the game. It can also lead to a lack of conflict resolution and social skills, because we're not getting that same face-to-face non-verbal element that we would normally get. And it can lead to other things as well, in terms of increased levels of emotional distress. We're not building our ability to, again, regulate significant emotions if every time something gets difficult we swipe onto another activity, or we go on YouTube and find out how to get past something easily. We miss the challenges of life to be able to move through a reasonable level of distress and discomfort, which is really helpful and healthy in developing resilience in kids.
So what would you say to us as parents and teachers particularly? What guidelines would you place around screen time in your house, and therefore with some of your clients?
Yeah, so I think that overall time limit is helpful, that the APA has recommended. I think that's a good guideline. But I think some other practical things that we can do is to ensure that that technology use is something that is done publicly and together as a family. I think that it's helpful for children to have their screens accessed in a public space like the living room or the kitchen where we can monitor what's going on. I think it's also helpful too to have curfews, so times of the day where technology becomes available and when it needs to be handed in. I think it's also helpful for these standards to be across the board for mum and dad as well. It's very, very hard for a child to understand why they can't have access to their technology if mum and dad are constantly on their phone or on their device, always in front of the television. It needs to be done as a whole family.
That's really good. As a parent, I know that you can tend to be doing things and not realise the impact that has on your kids.
Absolutely.
And that's, I think, a really important point. So on parents, I saw a blog that you wrote on your website, which I thought was really fascinating. And the question was, should parents fight in front of their kids? A very interesting blog. Can you maybe just give us a snapshot of, should we fight in front of our kids?
Yeah, sure. So the short answer is yes, fighting in front of your kids is fine. It's how you do it and what you do it about. So I think it's important for children to have positive conflict resolution skills modeled to them so they can learn from that. As I said, that's positive conflict resolution skills. So anything that is aggressive or disrespectful or manipulative should not be done in general and should not be done in front of children. That is not helpful, that's not modelling anything to them, and that's creating distress in the child. But if it's done respectfully and it's done well, it's a good thing for children to see. I think there are, though, some things that perhaps should not be discussed or worked out in front of children, though. And those are issues that they might be prone to worry about. So big health decisions about grandparents is probably not something to talk about in front of children. The main one's probably finance, in that often children will just worry about finance because kids, and developmentally so, are egocentric. They will then take on board this, I need to do something about this financial situation. They'll take on an increased responsibility, which is not appropriate for them. So I would say that's probably one of the situations that we wouldn't work out in front of the kids.
Yeah. Okay, that's very good. Well, I'm sure that you found that extremely informative. Thank you, Asher, for your time. We really greatly value it. If you'd like to find anything more about Asher, you can jump on his website, www.ashermorrison.com.au, or you can find him here at the Hamilton Medical Centre. You can just give them a call and they'll be able to give you some more information. Thanks for joining us. We have a great interview next week with Genetics Fitness Club and Marty and Danielle Rees, who are the owners of the fitness club. They're going to talk to us next week about fitness, the story behind that business that's been established since 1991, and some tips about how we can get our body in shape for the summer. So thanks for joining us, and remember, healing is a gift, health a responsibility. We'll see you next Wednesday. Cheers.